How does a hospice provide quality of care? What makes hospice quality different than nursing home quality, let's say? Nursing home, we know the quality metrics. They're pretty straightforward. You look at pressure ulcers, falls, pain control. But in hospice, it's different. In hospice, we view quality as, are we honoring people's goals? Are we doing goals of care? If they don't want to go back to the hospital, are we sending them back? If their goal, for example, I had a patient whose goal was said, when I pass away, could I have my daughter's quilt that she made for me on the bed? So hospice quality often involves things that nursing homes don't even think about. Goals of care, pain management. Every study I've ever seen has shown that people who are doing in nursing homes, people who are on hospice, have much better pain control than people who are not on hospice in nursing homes. So quality of care in hospice and in AseraCare means better pain management, which we train our people extensively in. Besides goals of care, advanced care directives, making sure we have those in order. And our Golden Living Centers do pretty good on that anyway. And then finally, symptom management. How do we handle nausea? How do we handle shortness of breath? And again, the pain issue. So I think the difference for AseraCare is a term, I'll use the letters if you just heard what I said, GAPS. We fill in the gaps. Goals of care, advanced care directives, pain and symptom management, and then the S is spiritual care. Now, is that just me speaking? There actually was a study done at the University of North Carolina, and they asked the loved ones, usually the family or the caregivers, of patients who died in nursing homes. And they said, how did things go? Did people die well? Did they die poorly? And what they found was 52% said, well, things went pretty well. 48% said things did not go so well. And so then the question was, what things did not go well? What things weren't done enough? And the number one was goals of care. Nobody was listening to what we really wanted. Number two, spiritual care. And number three was pain management. Oh my, can you see how the needs of the nursing home patients who are dying matches exactly the things that hospice and AseraCare Hospice provides? That's why I say, and I say this jokingly in a sense, but truthfully, that hospice and nursing homes go together like peanut butter and jelly. I don't really like peanut butter sandwiches. I don't like jelly sandwiches, but you put peanut butter and jelly together, it's pretty darn tasty. And that's how I view nursing homes and hospice, like peanut butter and jelly.